can't. Another interesting show coming your way today. In a few minutes, we'll have David Nino Rodriguez in here. He's a heavyweight contender and champion. He's the host of Nino's Corner on YouTube. And he has an incredible story of trauma and recovery and stuff I'm very much into. You can follow him on YouTube, as I said. Also, Nino, Nino Boxer on X, at Nino Boxer, and Nino's Corner.tv. And before we bring the heavyweight champion here, or the contender, Melissa McAtee is with us. She's a Pfizer whistleblower that has gotten us already kicked off YouTube, apparently. We're not loading on YouTube just with the name Pfizer and then her name.
Somebody came through. Oh. I think they're there. There was a big X next to it when we started up, and it still says X, but somebody on YouTube said, where's the link to Rumble?
Rumble, we have to go. We can follow her at Melissa McAtee 92, MCATEE. And we're going to talk about some of what she's observed and her quality control concerns over at Pfizer. Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for sake. Where the hell do you think I learned that? I'm just saying. You go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say. Joint and muscle pains are exhausting and frustrating, but I've got a over-the-counter medication I'll introduce you to that provides great relief using the power of, check it out, chili peppers. Capsidin is made with a proprietary formula that contains no non-steroidal anti-inflammatory agents, no opioids, no anesthetic or steroid, nothing, no chance for addiction, no side effects, no chance it's going to interact with other medication you might be taking. Capsidin contains capsaicin, which is the substance in chili peppers that burns your tongue. That gives you that burny feeling. And of course, I've recommended capsaicin creams to patients over the years, but other capsaicin creams burn your skin. That's what makes capsidin so unique. In clinical trials, capsidin has actually been demonstrated not to burn.
I've been using capsidin to relieve my pain in my hands and my wrist from carpal tunnel syndrome and arthritis. The results have been amazing. I use it every day during my show, and I highly recommend it.
Get the pain relief you need from various sources, even backache, sprains, bruises even. Order now at capsidin.com/Drew to get a 15% discount plus free shipping. That is CAPSADYN, capsidin.com/DREW. Susan's rubbing her cream in right as we speak. It made me actually jealous. I want something for my shoulder. I want to review, before I bring my guests in here, what's coming up for us. Winston Marshall, he's the former lead guitarist for Mumford & Sons. You saw him eloquently taking on Nancy Pelosi, free speech crusader. You saw him at the Oxford Club. Special 90-minute episode with Naomi Wolf and her husband, Brian O'Shea. Save our species. As always, Naomi goes to the mat, mostly because Brian gets us all so upset. So we'll see what they've got to say about the upcoming dangers heading our way. Then Patrick Bet-David, host of PBD podcast. James Metzel, future technology futurist, mentioned in the COVID origins cover-up email dump, and then by Tom Renz. Gabriel Shipton, who is Julian Assange's brother, and then Kyle Kemper, who is Justin Trudeau's brother. And then Salty Cracker, who needs no introduction. Let's go ahead and talk about our guest. Our guest is a whistleblower. She, a former manufacturing quality auditor for Pfizer. She worked under Pfizer's MQA for almost 5 years, 10 years in the plant total. She was fired when she blew the whistle against them in October 2021 for some of her concerns about manufacturing standards. And you've heard some of these same concerns from Sasha Latipova, and also from the Danish researcher who published the study about the various variation amongst the different vats of COVID vaccine. She can be followed at clouthub.com/Melissa McAtee, MC, capital ATEE, 2 E's, Melissa McAtee 92 on Twitter, and my Cloud Hub channel also. As I said, Steve Kirsch has gotten hold of some of her materials and the pit bull that he is, has been elucidating and expanding and amplifying her message. And then after that, we'll bring David Rodriguez in here, the heavyweight contender and champion, podcaster, host of Nino's Corner on YouTube. But right now, let's bring Melissa McAtee. Melissa, welcome.
Hello. Thank you so much for having me.
You bet. So I read through some of your materials, and I saw your PowerPoint, and I know you've been very public about your concerns. I wonder if you could just give us a sketch of how this happened, what you were concerned about, and what the response has been like.
Yeah, so I got hired originally in 2012 under Hospira as a pharmaceutical assistant. And then I got promoted. Pfizer bought Hospira in 2015 due to a warning letter from the FDA. And I think Hospira couldn't afford that liability. So Pfizer took them over and they were fully integrated by 2017, which is when I got promoted to manufacturing quality auditor. It was kind of the dream job of the plant. So I was super excited about that. And the major differences I noticed between the two pharmaceutical companies was under Hospira, there was a lot more transparency with the FDA. And then when Pfizer took over, things drastically changed. It turned into more don't speak unless you're spoken to. They would put supervisors in the hallway to redirect you so that you wouldn't cross paths with the FDA. They would shut down lines that the FDA wasn't there to observe. They would tell people to go hide until they left, things along those lines. So that was probably the sketchiest stuff I experienced before the pandemic. During the pandemic,
Let me, Melissa. I want to interview you. I'll interrupt along the way here, and there's a little delay between us, so it's going to seem like I'm stepping on you. I apologize to you and to the listeners, but it's interesting. I was just when you said that, I just thought, oh yeah, that's what everybody does, though, when federal regulators and state regulators come around. I know hospitals do that like crazy. So that in and of itself, it may be shocking for people to hear it, but and some of it is because things generally are over-regulated because some of the demands, some of the concerns are sort of ridiculous. But keep going.
That's right. Yeah, that's right. You can get in trouble for having gum in your mouth when you shouldn't, things like that,
Yeah.
But so once I became fully qualified in my job as a manufacturing quality auditor, it took about 6 months to be fully comfortable. You go through very intensive training for visual inspection of products and things along those lines. When COVID first came around, I fully planned on receiving the vaccine, but me and my husband kind of agreed to wait once we heard conspiracy theories going around. And I was like, well, I work there. We'll just wait. We'll see how it goes. And if there's anything weird, then we'll reevaluate. There was a lot of pride amongst the plant and employees. Most of us were excited that we were partaking in the manufacturing of the vaccine. But it kind of all changed when I'd heard this conspiracy theory and I didn't know if it was true. And one day I went down on the line the first day that we were actually inspecting the product. And I walked in and it didn't look like any other product that we had made. It kind of had this fluorescence to it. It color shifted, things like that, which just isn't normal for products that we normally dealt with. And we didn't have the proper documentation for me as a quality personnel to be able to verify, does this product look correct? Or is it abnormal and it needs put on hold? And when I elevated those concerns, I followed the proper chain of command for quite a while. But was always told, given operational warp speed, it's permitted. And so a lot of my concerns were kind of just shoved to the back and ignored. And then when we finally did get the documentation for the product, it's called a controlled monograph. It was wrong. And so I put the batch on hold, I elevated it, proper chain of command, and I was told, because the paperwork said that it was clear to a slight yellow, which is partially true. But if you put it on any background darker than white, such as gray or black, it color shifts to this periwinkle fluorescent color. And I had never seen that before. Most of the products we deal with are a lyophilized product, clear like water, or have that slight yellow tint. So that part wasn't weird, but the color shifting was. And that was kind of my first.
Why would that be a concern? Although it's unusual, why should anyone be concerned about it other than just to answer the question, why is this happening?
It's concerning just because the conspiracy was that the vials glowed and that there was this ingredient in them that was really concerning. And so I emailed Albert Bourla directly, and he forwarded me to communications. And my question was, hey, why is the vaccine glowing? And they responded with, we aren't aware of any glowing. Do you have any pictures, basically? And I just felt like that was kind of a trap because even though I was quality and I had a camera pass and I was allowed to take pictures, they could still fire you for taking pointless photos.
Mm. Mm-hmm.
So
So
after all of that,
you didn't send them the pictures, or you did?
I didn't. I never
Okay.
responded because I felt like it was a trap.
Okay.
And I was uncomfortable. And as things kind of progressed throughout the plant, I noticed a lot of our typical good manufacturing practices and standard operation procedures were being totally disregarded for anything, any product. It didn't have to just be the vaccine.
Hmm.
And it definitely bothered me that stuff that we would have been fired for just a year previous now was allowed and encouraged, such
Did you
as
talk to
allowing.
peers at your level of management? Did you share these concerns with people at the exact same job that you have? What was their
Yes,
response?
a lot of people got skeptical once we started having it in the actual plant, which would have been around spring of 2021.
Mhm. And so skeptical, they were alarmed like you were, or they were just like confused?
I would say it was a good 50-50. 50% of them were very freaked out, especially the ones who had already gotten the vaccine before we started producing
Mm.
it. And but the other half just was kind of like, well, I must not understand why it looks weird and everything's weird, so I'm just going to get my paycheck and take my benefits and go home.
And at that point, it's was not at all clear who was right, right? I mean, maybe that was the right approach. So how does it evolve
Yes.
from there? Yeah.
Well, obviously, I didn't want to throw away my almost 10-year career away over a hunch. So I just kind of started paying attention more, kind of started watching more doctors who maybe spoke out against the narrative. Some of them were like Dr. Jane Ruby, I heard a lot of in the beginning. And I just, even though I just couldn't fathom that my employer would do something that evil, and especially me working for them for so long and not noticing it, um, I was just skeptical and I didn't want to throw everything away right away. And I think that's how a lot of employees felt was we were kind of gaslit.
Maybe it wasn't evil. Maybe it was just lazy. And when you had the justification to just be lazy, i.e., warp speed, people do that.
Mhm.
Maybe it's as simple as that.
Human nature, right? They wanted more profits, more numbers, and that's what they focused
It's
on.
hard to do the kind of regulatory precision that are required of pharmaceutical companies. I would imagine as soon as the heat's off, it just it just drops. I would imagine that would be a sort of a normative process. The question then remains, what is the consequence of that?
So far, I've seen no consequences. Pfizer's just continued to truck along, and after they fired me, the only communication that I had from them was they about a year after whistleblowing, they sent me a letter in the mail requesting $900 for overpayment for using unaccrued vacation time when they sent it to all the employees who lost their jobs during the pandemic, whether that be from refusing to get the vaccine or they quit due to what was going on out there. Technically, it was Pfizer's fault that anybody had to leave before their vacation had accrued. And so I don't think anybody really paid them back or anything. And that's the most I've heard of them since.
And then one of the big concerns throughout this pandemic has been the lack of um, attention to not just risk reward, but informed consent. And we're even getting into it again now. We have a new JN.1 vaccine coming out, and how do I give informed consent to a 35-year-old male? I mean, how do I do that? And what am I, and then when you do it, you're worried that you're going to get in trouble for trying to give informed consent. It's just a crazy situation. But at that time, being fully informed was difficult. It was hard to know what was going on and how to inform patients, and we weren't allowed to talk about that. Did you worry about that at the time?
So I didn't. Here's the thing. I didn't really think they were withholding informed consent until I found their internal database. And that's kind of where I found the emails. I call two sets of emails. One set is called the aborted fetal cell line emails, which is what Project Veritas focused on with my initial release interview in 2021. And then I have a second set of emails called that I call the graphene oxide emails. And those were really upsetting and shocking to me. And that is when I kind of knew I wouldn't be returning to my employer because they were going through great extent.
So the fetal cell thing was interesting because those emails, I read them, you sent them on a PowerPoint, and they were really egregious. Okay. This isn't going to be pertinent for everybody, but I want you all to think about it in terms of informed consent. If you had very strong religious views, and if I'm your doctor and I know you have very strong religious views about the use of fetal tissue under any circumstances or animal tissue, what if you're a PETA, advocate? I want to be able to give you thoroughly informed consent if you decide to use a product that would violate your moral sensibilities. And how could I do that in this case if they're denying what they actually did? So tell me what the facts were.
So what they were doing in the fetal cell emails was people think I'm whistleblowing that aborted fetal cell lines are in the vaccine or that they were simply used. Wasn't the point of me coming forward. It was, look what these executives and internal Pfizer employees are talking about behind the scenes and how they're speaking about relaying information to the public. If we can't trust them to give us informed consent, they had no business mandating their vaccine to people, let alone putting people's livelihoods at risk for something that was a lie. It was a lie. They let people lie for them.
And let's be fair. Again, it's on us. I mean, I imagine you as an employee felt responsible to sort of set up informed consent, but the informed consent is really on us, the practitioners. And if we don't have the information, we're still guilty of not giving informed consent. That's still on us. And so doctors should be mortified by this, that we were put in a position, and it's not even some sort of legal liability, which it is. It's really a moral shortcoming. We fell short of our job because we couldn't do our job. And I start to worry when I saw those emails, what else am I not getting access to? That's where your brain sort of naturally goes. And I'm sure that's where you went too.
Exactly. It was, can we trust them for anything? My grandmother is a devout Catholic, and she got the Pfizer vaccine specifically because she was told there were no aborted fetal cell lines used, and as were many were told that. And in those emails, they talk about the Pope is okayed our extensively vetted or couched answer. And so we want to stick to that so that people can't get religious exemptions, basically, is what the whole point of the email is. And then they go on to talk about managing. They're afraid that a lay person would get the information and they would have to manage a Facebook campaign. So there's your collusion with Facebook and Pfizer.
The disdain and general would the approbation be the right word towards the average patient, the average person, the average citizen? Mind-blowing. Mind-blowing. We're just, what are we, meat puppets, and they just, they're the big almighty on high. It's just a weird attitude. It's just like
they call us customers many times in the emails. That's how they see us.
All right, okay, that's fine. They're a business. I'm really trying to be charitable. Because we got to be really careful. Drug companies do a lot of good, also, guys. I mean, when this all started, and you worked in the field for 10 years. You were, I'm sure, proud of what you did. I am an internist, so that's all I can do. It's one of the big things I can do anyway, is using pharmacology to address illness and to make sure the course of the illness is improved. That's because of research, huge research dollars spent by pharmaceutical companies. And personally, I'm on a couple of medications that were now generic, but were developed by Pfizer. Thank you. I really appreciate it. So we have to be like, not throwing the baby out with the bathwater. But I'm wondering how you manage that.
Well, I mean, obviously I wasn't an anti-vaxxer. I worked with injectables for a very long time. But after all of this, and I started to do my own research on childhood vaccines when I became pregnant. And during my birth, they tried to give me Pfizer drugs, and I told them I wouldn't take them unless I inspected them myself. And then that opened a whole can of worms because they told me they don't inspect medicine before they give it. And I told them, well, when I worked at Pfizer, I can tell you right now, we fail a lot of product and a lot of it still squeezes through. So you should always inspect the product before you administer it.
So
to a patient.
hold on, Melissa. It's
love
rare that
that.
Susan reacts like that. She was like, whoa.
Oh, I know. You have to control
Stuff's
what happens to you in a hospital when you're giving birth. Trust me.
Well, it's interesting. You know, I've had to run. This is kind of a different topic, but it's a corollary to what you're saying. I've had to be a pulling guard for my family when they're hospitalized or having medical issues. And every time that, Susan, am I overstating it?
Nope.
Every time I think to myself, my God, if I weren't a physician, if I didn't have a license,
I'd be dead if I didn't have them around.
You for sure would have died 3 times. but for sure, that no hyperbole. Actually, that's about the number.
And my kids,
My husband thought I was going to die
triplets and-
during childbirth.
Yeah.
yeah, I almost did. But giving a vaccine to a pregnant woman with triplets, absolutely not.
Well, that's the patient they're talking.
Experimental. The fact they were pushing an experimental on pregnant women and trying to get it to kids. That was one of the main reasons there was urgency in me trying to blow the whistle, was because they were trying to get it to kids.
So again, I want to sort of shine a bit of a light on that, which is that we are one of the only countries on earth that requires it early into childhood. So there's sort of no justification for that, but okay, up to the patients and the doctors. The pregnancy data is, I don't know what to make of it, because Naomi Wolf is on full alert. Vicky Mail has compelling data that it's okay. That has to get sorted out still. I'm still personally on the fence with that. But what I don't like, and this is what I want Melissa to address, and correct me if I'm wrong, other than the fact that it was used out in the community on pregnant women, it was never studied on pregnant women. Is that accurate? Yeah.
That's right. Most medications weren't at all. That's why it says on almost every bottle when you're pregnant, ask your physician if you're pregnant, so that manufacturer isn't responsible and they put it on your doctor. It's the same thing. With
the only medication I'm gonna ask the what happened to John Campbell? This says last video proof is quite sad from John Campbell. Somebody, Ike Deal, please explain to me what that was. Number one. And number two, anyone on the Restream or the Rumble Rants, let me know, what was I going to ask? Oh, if you know the one medication that the American College of Physicians, the highest level quality standards for general medicine, what one medicine they suggest that you continue with absolute impunity during pregnancy. I only know of one medicine that they state that with. I was shocked when I saw it on my board review. Because I didn't think there was any medicine that you can just continue during pregnancy with no concerns whatsoever. Do you have any sense of what that would be, Melissa?
I would think while I was pregnant, the only thing they ever shoved at me was Tylenol, but I don't even know if that counts. So
Tylenol does count. I actually worry about Tylenol, but yes, they will allow it to you. Some of the people on Restream, I can't quite see your moniker there.
I'm going to give them a hint. I just had to put a disclaimer up on screen.
Oh, they got it. Several of them got it. So I will tell you that only medication I'm aware of, and I've prescribed it many, many, many hundreds of times, is hydroxychloroquine. That is the only medication that medicine, people were shitting themselves for daring to prescribe it. And here comes the disclaimer that Caleb has to put up. If Melissa herself doesn't get us canceled, me saying that word will get us canceled. So there we are. So what a world we live in. Ike, video is proof of what, my friend? New update stats, I see. That's probably about the Ike deal is talking about the increase in mortality that we're seeing, which is for real. Yes, Lakeside was told no to take Tylenol during pregnancy. That's me. I don't let pregnant women take anything. I just say no to everything. Why do that? Well, Melissa, where do things stand now?
Well, I was really struggling to find a job after leaving. And then when I became a mom, I obviously needed to go back to work. So I currently work for a company called Vax Choice and Clout Hub, and I'm actually a producer on there now. And I'm really thankful for that job because they've helped stitch up some of these loose ends. And I continue to learn more about my evidence and what I have. And so I'm really thankful for them at Vax Choice because they always bring the receipts we don't do the trust me stuff. We do the here's the evidence, and that's what I enjoy, which is why people ask me, why didn't you leave sooner from Pfizer? Because I didn't want to be crazy. I wanted to make sure I was right. I needed the evidence. I needed the hard proof. And once I searched that database and the emails were the first thing I found, I was sick to my stomach. I went and prayed about it. And when I went and prayed about it, I turned the corner and I saw they were blacking out windows, which is against FDA regulation, before the FDA visit. And I just knew in my heart that I wouldn't be returning after that day. So nothing's been done legally. They are still doing everything, not following good manufacturing practices, standard operation procedures. Nothing's been done whatsoever. My story's been heavily censored. So if people haven't heard of me till now, that would be why. Things have kind of lightened up a little bit since Elon took over X. And today I'm still looking for help. I'm looking to, at the very least, if I can't get legal justice, I would really like the opportunity to share my story as much as I can so that people do have the informed consent so that they can make educated choices. So that's what it is.
Couple of things before we wrap up the vaccine conversation. People are still wondering a couple things. We talked about the glowing vials. You showed the picture of the glowing vials. Did you ever figure out what that was?
No, I've had some answers that are satisfactory. There's a woman named Dr. Anna Mahelcha, and on my birthday last year, she released a video showing that it was quantum dots, nanotechnology. What's the other thing? Quantum dots, nanotechnology, and hydrogel was her explanation. Some people have said other things, but I can't confirm. And Pfizer won't answer why it looks this way or why it behaves the way it does and why they weren't actually advertising the real product at the beginning. Was there a reason for that? Things along those lines. No, I have no solid answers because I don't think we'll ever know unless Pfizer decides to tell us.
And something about the package inserts not being properly distributed in the with the vials or something? Is that part of what you saw?
Well, the inserts were either totally blank or totally missing, depending on the batches. And the labels were placed extremely low on the vials so that you couldn't see the solution, which is a big problem in the quality world, because let's say they label 10,000 units and then they realize there's a label problem. Well, me as quality, I have to go in there and still inspect those. So Pfizer has to spend more time paying for rework, which is where you have to peel the labels because you can't see the entire vial like you normally should be able to.
And then finally, you skated past graphene oxide. You just sort of touched on that. You want to tell us more about that?
Yeah, so a lot of people are in denial about the graphene oxide, which is okay. I mean, that's fine. But from Pfizer's own mouth, they have 2 emails that I share with people where it's a woman asking a man. She says, hey, I keep getting this question about graphene oxide. Here's my proposed answer. What do you think? And her proposed answer is graphene oxide is not in the Pfizer COVID-19 vaccine, but we cannot guarantee that minute amounts of substances from global suppliers for our products didn't make it in there. And that's the gist of it. She said, but we can't promise it's not in there, basically, because we use global suppliers, which is China. And so there we go. And his response was, leave out that entire second part. Just say it's not in there, which to me is informed consent that they're withholding on the topic.
It is back to informed consent, but it's, I don't want people to get excited about words and images that sound exciting, okay? Just because the stuff glowed or turned this sort of fluorescent shade may have a viable explanation to it that may be inert. Maybe. So don't get too excited. And graphene oxide at certain concentrations, probably not that big a deal. The problem is they're not forthcoming with the information so I can give it to a patient to make a decision about whether they want to believe that or take that risk or not. Can't do it at all if you're saying there's no graphene oxide in there, correct? So the issue is not, oh my God, it's glowing, I'm going to glow, or graphene oxide, graphene sounds bad for me. This is not the point. It's not the point. You have to be really careful. like this new study that came out. It's actually a good study on excess deaths, excess mortality. It's really, I encourage people to read the BMJ article. It's very good. It doesn't say the excess death is caused by vaccines. It doesn't say that. It finally says we have excess deaths, and we can finally say that with a good deal of certitude and move forward and try to figure out why we have excess deaths. 3 days ago, you couldn't say they were excess deaths without being smacked down. Same thing with these ideas. You couldn't have said until Melissa came up with the emails, there's graphene oxide in this vaccine. Regardless of the implication of it, you couldn't say it because they would deny it and slap you down for it. And yet here are their own emails obfuscating.
Yes. And they also, I have a PowerPoint slide from one of their presentations where it was a screenshot of the VAERS data, and Pfizer's own words was the VAERS data is inaccurate, which we know that means it's underreported, not overreported. And they acknowledge in this PowerPoint slide that 510 people died from their vaccine by February 16th, 2021. It's in the fine print at the bottom.
Well, and 20% were lost to follow. 20% were lost to follow up. There was a 2-week window where nobody was assessed. I mean, there's a lot of weakness in the study. Joe Freeman was pointing out the endpoints were wrong. There's a lot of reasons to be concerned about the studies that they did do. But I'm still here to say, at the beginning, there probably was, good justification to cut all the corners and to distribute vaccine, and old people were dying at 2,000 people a day and stuff. And so there was a justification for all of it at the very, very beginning. But once it settled down and once there were questions, we should have stopped. We should have stopped right there. Like we normally do, right? And Melissa, you're a quality control officer. That's what we normally do. We go, hold on, we got to check this out. We got to see what's going on here. Instead, here we are years later with no answers and continued push.
That's right. And that's my biggest concern is the things that they knew that they allowed people to, basically Pfizer never issued any corrective statements. Pfizer never made any finalizing statements on these conspiracies. They allowed the big tech to censor, to fact check, and it was all wrong. And so that Pfizer can sit there and say, well, we didn't lie to you. They told their own employees, I've submitted some emails recently where they were telling us, as Pfizer employees, get your COVID vaccination to prevent the transmission of COVID-19. But then they come out later like, oh, wait, hey, we never said that it prevented transmission. Well, yes, they did. They were telling their own employees that.
Oh, yeah. Oh, for sure. Of course they did. Well, I don't know if they didn't say it, but it was being said on their behalf. And they certainly didn't smack people down for saying that the way they would smack them down for graphene oxide or glowing tubes. The other thing, it's interesting, there's all this, people can't seem to stay in the middle zone in the sense that I'm getting all this heat now on social media, like, you need to apologize for ever giving your patients an experimental vaccine. It's like, hey, I have a lot of patients, 85 years plus, who were at severe risk. One died of COVID, and they wanted the vaccine. And by the way, I was clear with them that I didn't think I could give them fully informed consent, and they still wanted the vaccine. And I only saw one adverse reaction in the very elderly. I made a VAERS report about it. They did not follow up. They ignored me completely. It was a serious, life-threatening incident in a 99-year-old. So I have now seen a single adverse event in my patients. Now, to try to say, I know Steve Kirsch, who gets a hold of your material, would say, well, there's still going to be cancers and heart disease and blah, 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 blah. I don't know. We don't know. Maybe I helped them. Maybe COVID itself would have, had they survived it. Also, the spike protein seemed to me to be the pathogenic mechanism in all this stuff. I don't know how you feel about that, but whether you get spike from COVID or the vaccine, I'm worried about it. I'm worried about the long-term effects. What do you say, Melissa, to that? And then we'll wrap this up.
Well, I'm not a scientist or a doctor, but I will say, just in my anecdotal evidence in the world around me, I knew one person who supposedly passed away from COVID. But I don't know. I can't confirm or deny that. I didn't know her at the time that she died. I knew her earlier. And then, but I will say, my mother-in-law got AFib after getting 2 doses of the Pfizer vaccine, which Pfizer has come out and said they've given 5 million people.
Very common. And they're not yet come clean about that. I've seen a crap ton of that. I have.
Yes. So
including, by the way, the 99-year-old I was talking about. And here's how it goes. In people that are very elderly, you go, oh my God, you have new atrial fibrillation. You're not doing very well. You're coming into some heart failure. You need to go to the hospital. No, I'm not going. That's what a 99-year-old will tell you. And so it's like, okay, I'm gonna have to manage this in your apartment, which I successfully did, amazingly. But I was pissed afterwards, and that's why I made a pretty dramatic VAERS report. And we made it through by the skin of our teeth. Anyway, so Caleb has a question for Melissa, and then we'll bring
a
David
quick question. I was just thinking of this recently about how we've done hundreds of shows on these types of topics, and we're definitely not the only one. There's now thousands of videos from prominent doctors that are all over the place talking about this, but we have not received a single email, call, anything from Pfizer trying to clear this up. They haven't even tried to answer any of these questions, haven't tried to suppress. So if everything they're saying on their side, they have a way to refute what's being said here, they've literally given zero effort to shut that down, except to use their big media people and just to run a lot of commercials. They haven't responded to any of this stuff. Is that typical for Pfizer, in your knowledge, like with your experience with them, to just ignore these issues? Or is that indicative of they know something else and they just don't want to even go this direction at all?
They don't want to give attention to the people speaking out. That's really it, because they have a very, very strict NDA, social media policy, all of those things. So
but this hasn't reached a level of like threatening their profits of
Caleb,
mainstream politicians. The presidential politicians are talking about this.
If they had real liability, there would be a whole set of other kinds of machinations they would go through. But the EUA gives them no liability, so why would they involve themselves at all with this?
Unless you can prove they committed fraud.
Right.
Against the
it's
government.
That liability. They have that gigantic liability there, which why ever trust a product if you can't sue them if the product is harmful? It makes that part zero sense to me. That's ridiculous.
It won't happen, guys. I know maybe Veritas can prove it, but I don't think it's going to happen because the government gave them such a wide berth in this warp speed thing. They really did. And of course there are going to be corners cut. Of course there are going to be problems. Why would there not be? How could there not be?
Mm-hmm. Yeah, they promised the president that they would follow good manufacturing practices, and they didn't.
All right. This is a great place to stop, which is you as a quality control professional. If they said to you, hey, we're widening the standards of regulation and your quality control so we can get this stuff out and through now, would you be surprised if there were some shortfalls in the quality control? Would that be shocking to you?
Not at all.
No. Right. Could you imagine that it'd be anything other than that, unless a stroke of luck befell the factory? Could it be possibly another way?
If there was more integrity and people actually held them accountable, Pfizer literally paid me to make sure they were putting out good product. And then when I would raise concerns, they were like, sit down and shut up. And so that's just kind of how it goes.
It does not. This doesn't surprise me at all. When they came out with warp speed, I actually kind of thought to myself, this is shorthand for half measures.
Thank you for speaking up.
Yeah. Well, thank you for taking the heat, and thank you for coming in today. And you want people to go to Melissa McAtee.
She's going to hang around, right?
If she wishes, we're going in a totally different direction.
Just in case.
You want to sit around? You can. You're welcome to stay with us. Maybe David has some questions for you, but we're going to go down an entirely different road here. So, all right. Well, we'll bring David in, and we will because I've seen some of the stuff.
Drew's getting this flashing red sign that we're over.
Yeah, I'm
10
over time.
minutes
So,
over time.
All right, Melissa, let me go to break, and then we'll bring David in here. You're welcome to stay with us, and if David wants to go to you, or if I need to go to you, we will. So. Please do support the people that support us, as we say every day. We are very lucky. I just had my bone.
And thank you for supporting the sponsors we have. Everybody's buying this stuff, and we're very happy about it.
We're so fortunate. We're so fortunate to be in business with good people who are trying to do good work and have great products. And we use them all. We literally use them all here. So
I mean, if you can't afford all of them, just maybe one.
Well, and I've got a goal to try to. If you like some of these things that are there, the top, like True Niagen, I'm trying to find things to make things more affordable. Anyway, watch this, pay attention. Don't forget our friends at MyPillow too. I don't know if I have a chance to mention them at the end, but be right back. course, I'm a fan of the healthy aging supplement True Niagen. I've been taking it almost for a decade myself. This supplement boosts NAD, which your cells need to survive properly metabolically, and it goes down as we age. It does so with a nutrient called nicotinamide riboside, or NR, specifically patented form of NR called Niagen. It's the most efficient and trusted NAD booster. NAD can also play a role in reproductive health. Boosting NAD is recommended with prenatal vitamins for women over 30 looking to start a family. Here's Dr. Amy, also known as the Egg Whisperer, a highly influential specialist in this area.
As NAD levels go down, and it starts going down in our 30s, that's the same age that our egg supply also dwindles. So I'm fighting for every single woman's chance to have a baby, and repleting NAD is one of the greatest tools in my tool chest that I've been using now for almost 6 years.
True Niagen is an amazing NAD booster. You're going to want to add it to your reproductive health arsenal. And of course, it's in our family of Dr. Drew sponsors. Go to drdrew.com/True Niagen for 20% off your order. That is drdrew.com/True Niagen. Enter Dr. Drew at checkout for 20% off. You could spend thousands of dollars and dozens of hours trying to look a few years younger, or you can skip all that and the hassle and go with what works, Genucel Skincare. Genucel is the secret to better skin. Their products are made in the USA using a proprietary technology that combines a naturally effective base with non-GMO ingredients. In fact, you might have witnessed the astonishing effects of Genucel during a recent unplanned moment of our show, when just a little Genucel XV restored my skin within minutes right before your eyes. That is how fast these products work.
I know I'm a snob about the products I use on my face. Everybody knows it. Every time I go to the dermatologist's office, they're just rows and rows of different creams. Retinols, vitamin C cream, under eye cream, night creams.
Scrubs.
And then when I get to the counter, they're overpriced. All kinds of products that you can all find at Genucel.com.
Susan and I love Genucel so much, we've created our own bundle so you can try our favorite anti-wrinkle creams, correcting serums, under-eye treatments. Say goodbye to those fine lines, forehead wrinkles, skin redness, even those dark under-eye bags. Women and men of all skin types, Genucel has got you covered. Order right now at Genucel.com/Drew to save 50%, actually over 50%, and you'll get a free luxury spa box plus free shipping. That is Genucel.com/Drew, GENUCEL.com/DREW. There are 4 distinct and outstanding medical kits from the Wellness Company: a first aid kit, a travel emergency kit. I was very instrumental in developing that one. I love it. A COVID emergency kit, but let's unpack their medical emergency kit, the one that gives you immediate access to treatment for a variety of medical conditions. Here's the kit: pneumonia, upper respiratory infections, skin infections, gastrointestinal infections. You'll have on-hand medication that will even serve as immediate prophylaxis against a sexually transmitted infection, rapid intervention for Lyme and other tick-borne illnesses. Of course, we've added Tamiflu to our kits in case the avian flu should become human-to-human transmissible. Then we know something is up and we want to be ready. And look, we want to be covered for bioterrorism even. And of course, the Nobel Prize-winning antiparasitic ivermectin, and a how-to guide and a virtual consultant. Get access to these prescription meds by going to drdrew.com/TWC to save 15% off. That is $30 off the medical emergency kit. drdrew.com/TWC for 15% off the kit and any of their kits or their supplements. Do it now. drdrew.com/TWC.
Dr. Drew said the best way to quit drinking is by going cold turkey, and he's a doctor, so why would you question doctors?
Dr. Drew called me unfixable.
That's true.
It's true that I called her unfixable.
No, she is unfixable.
Oh, hysterical. All right, let's bring in my next guest, which is David Nino Rodriguez, heavyweight contender and champion, is podcaster, host of Nino's Corner on YouTube. His book is When the Lights Go Out: From Survivor to Champion. You can follow him on X. There's the book, at Nino Boxer, and Nino's Corner.tv. David, welcome to the program.
How are you, Doc?
Good to see you, my friend. So you've heard this conversation we've been having about obfuscation and people, treating the public like they can't handle the truth. I saw a tweet where you had some choice words for Dr. Birx, who wants to go test every cow in the country now, and you've been very blunt. I'll say you've been outspoken. So let's start where you would like to start.
Well, I mean, my whole platform now is everything war on the deep state. Okay. I've been doing this since 2020 when all this broke out. I like to say that it's my channel's for the awakened, not the woke. And I go in a different gear, a different lane for people. So it's kind of we've been ahead of the ball. We've been ahead of the curve on a lot of the things that we discuss on my channel. So I'm very proud of that.
So you're a conspiracy theorist, is what we'd call you. And so
conspiracy
80%,
scientist.
80%, and so 80% of what you conspired about turned out to be true magically. So
I mean, no. I mean, it's been pretty much over the target. It's been a very fun ride. I mean, as we all know, we're all in this together. This has been crazy.
Yeah, it's been nutty. I've only recently come to really kind of clearly understand what people mean by the deep state. I was talking to Dr. Alexander, and where's he from? Trinidad, and he's got an accent, and he looks like he should be left leaning, and so he was called into the inner circles when he was working at the HHS, and was told by the lifetime bureaucrats that worked there that he needn't concern himself with the people or the elected officials because they're here only for a few years. We run the state. Here it is. Here it is.
In the HHS in that building during COVID, it was held for me from the deep state. And there was every effort to subvert Trump. President Trump would have occasions where he would invite the staff to his Trump hotel in Washington. So on one of those invitations, I went there. I was with Dr. Scott Atlas, and we were hanging around talking with other people. And there were these people from the State Department. And one of them told me something that surprised me. They said to me bluntly, they said, President Trump is only visiting here, He's only a visitor. The POTUS is a visitor. We run things here. We, the administrative state, run America.
And when he said that to me, it was like, whoa! I like that blew my mind. Now you're shaking your head like, yeah, that's how it goes.
Yeah, well, I mean, it's both sides of the aisle. The deep state is the rhinos and the Democrats. I mean, it's both sides. We're in a captured operation. We're in a, most of these politicians are completely compromised. I mean, it's all coming out now like gangbusters. One thing that I was thinking about when you were talking to Melissa is that I thought should have been brought up, that she should have brought up, maybe I can bring it up, was the additive in the vaccine called luciferase. I think we talked about that on my show when I had her on, and I think that's a huge deal. And
people were saying that on the restream. Melissa, maybe you want to come in and address that. Go ahead. I know it's, again, I always worry about these things with these extreme names that people are going to hang on to the name.
Well, leave it to me, Dr. Drew. It's okay.
But go ahead, Melissa.
Well, that was the conspiracy theory that we were hearing at the plant. And I'd only become a Christian in January 2019. And so when I heard the theory that luciferase was in the vaccines, I obviously was like, surely they're messing with us. Like, surely that's a joke. And I didn't think much of it. I researched it, didn't see anything really crazy about it. And then when I saw the glowing, that's what triggered me to be like, okay, why? So, and they still don't.
I'm gonna let that one stop unless I know something more about it. There is such a thing. It's a catalytic domain, generic term for a class of oxidative enzymes that produce bioluminescence. So there you go. That's the Wikipedia, and is usually distinguished from a photoprotein. Blah blah blah. So do you know, it's from fireflies and beetles and things like that. Why would any sense of why they might have that in the product, Melissa?
Well, I know why they used it in the testing, which is they trace where the vaccine goes within the body, and they would use a light frequency on the mice called M-cherry, and they would see where it went with where it concentrated. They knew it didn't stay in the arm, obviously, but that's what they use it for in the testing. Why it would be in there for people, in my opinion, this is my opinion, this isn't fact, this is just why they would put it in there, is traceability of who received the vaccine.
Oh, interesting. So maybe they were playing with that at some point. Now, it looks like it's a fairly benign compound in terms of its effect on humans. So I don't want to get too excited, but I need to look more into that. All right, Melissa, thank you. I'm going to go back to David. Tell the story about, that your road from trouble to recovery, if you don't mind. So, because that's sort of my thing, is how, people's bottoms intrigue me, and how people make massive change is really an important thing.
Well, that's the threshold when you hit rock bottom and find out there's a basement. You know what I mean? Like I hit rock bottom and did find out there was a basement. I got to tell you, I've been 4 years, and this month will be 4 years and 6 months sober. So I'm on my road to recovery. I've been doing well, but my life was very extreme. I was juggling many different extremes, like a lot of fighters do. I was juggling, alcoholism, drugs, fighting,
painkillers,
oh yeah, everything. I mean, I was taking handfuls of those. 2011, I was 36-0, 34 knockouts, 21. I do still have the most first round knockouts anybody out there right now. Is 25 first round knockouts. I was on my way to the top, man. Like nothing was stopping me. Got in the top 10 of the big belts, was just on my way, but it was just, I can say it now looking back, my whole boxing career was from as a child based on insecurities. Like, I don't know, I was bullied as a kid my whole life, and I kind of wanted to name my book Bullied into Champion. That's kind of where I wanted to go with it, because really, I think there was a lot of deep down insecurities for me growing up, and I just felt the only way to solve that would be to fight against it and live in that hell, which was boxing. And my entire boxing career was just me exercising those demons, and also flirting with or suffering from other extremes like alcoholism and the drugs. I mean, it was one extreme to the next my whole career. In 2011, that's probably the most turbulent and crazy year I had, because I literally died twice. I overdosed on drugs in a club after one of my big fights of winning. I think it was the WBC Mexican Heavyweight Championship. I went to a party and was drinking, and I took a mouthful of painkillers and Adderall, and somebody gave me a flask, and inside that flask was GHB. I drank the whole thing, and that's all she wrote. I was out, and 9 hours of my life I can't recount for. It was all third person testimony that told me what happened. I blacked out in the bar. I turned blue. I was convulsing. I was having cardiac arrest. Mm-hmm. They took me out. They threw me in the alley because they didn't want the liability. The bouncers did. I mean, it took a lot of bouncers to carry me out of there, from what I hear. Mm-hmm. But they threw me into the alley, and that was that, man. And a lady that was an off-duty nurse at the time told my friends, she goes, "If he dies, I'm blaming all of you." And they got in their car, and my friends got in their car, put me into the truck, and took me to the hospital. And from what I understand, the doctors and nurses came out, put me on a gurney, rushed me into the hospital. And the next thing I know, I wake up and there's doctors all around me saying, "We got him back. We got him back." And I just remember there's like throw up all over my chin. And I was in ICU for 8 days, and came back, won 2 more belts after that one. And then December of the same year.
Now it's time to go to the basement. Yeah. Like every good drug addict, you got to try it again.
No, I didn't even learn.
I know that
learn anything, Doc. I didn't learn.
Coach, I get it.
I was just getting started. And so after that, I was walking out of a bar. There was some kind of scuffle inside the bar. This was in Phoenix, and I heard footsteps behind me, and there was an altercation. And let me tell you, I'm not playing victim. I'm not one to play victim. I was inebriated. I was under the influence of alcohol. I was wasted. And I heard a bunch of footsteps behind me, and I looked, and it was I don't remember any of their faces looked like. It was all a blur. And the next thing you know, I just saw something shiny out of my peripheral vision, and then slash They gutted me. They cut my whole throat open, missed my artery, and I just remember bending over and blood pouring out of my neck. And then when that happened, I just knew. I go, this is it. I'm dead. I remember that realization of just, holy cow, man, this is how I die. This is how it goes down. This is it right here. And my friend comes running to the side of me. He's like, oh my God, what's going on? I saw him lift up his arm, and they started viciously stabbing him. He fell on top of me, and I remember screams and yells all around me. And then the next thing I remember, I'm in an ambulance, and I'm covered in blood, and so are the paramedics, and they're dropping needles and things like that. And I just remember I just felt this warm feeling like I'm going to pass over. And I just said a prayer in my mind. I just said a prayer to my parents and God, and said, I'm ready. And that was that. I really thought I was going. And I woke up a day and a half later, and they had a therapist come in to talk to me because she was going to be the first to show me my face. And I don't know if you can see it, but
oh yeah, you can see it now.
And it was a great cosmetic surgeon that was on call that night. I mean, I took 369 stitches inside and out, and she saved my life. And then really after that, Doc, is when the PTSD kicked in, and 10 years of my life, I was just really having a hard time. And it didn't take my life, but that incident nuked my professional career. Well, it nuked my life. And it took 10 years to bounce back. Yeah.
You had to change. And still no sobriety until 4 years ago, right? That was 10 years ago. It's really interesting, right?
I was like, ain't nobody's gonna stop me. I had this like, complex,
well, I want to examine that a little bit, because did you have the same sort of political bent that you have now back then, say 10 years ago? This is a new thing.
I was awake. I would consider myself, I was awake. I call it waves of awakeness. You have JFK, you have 9/11, and then you have COVID. And for me, it was really 9/11 that I started. There's a lot more to the picture here than what they're telling us. And so, yeah, I was onto the globalist agenda and all that stuff. Yeah, I've been pretty awake.
And I recently, yesterday, talked to a couple of psychologists that feel like their evidences and their experiences taught them that too many people, because of helicopter parenting and narcissism, see the world as an external locus of control, not an internal locus of control. Like everything just happens to me and I'm helpless, right? And you actually used the word victim a few minutes ago. You said, I'm not a victim. And that kind of intrigues me that you see the world, you feel responsible for everything. The world is what the world is, and you want to address it, but you don't feel victimized by the world. Would that be accurate?
100%. If you're walking down a dark alley and you get mugged, I feel like, why are you walking down that dark alley that is sketchy anyway? Yeah. Shouldn't be there.
Yeah. And so how do we deal with so many people that don't feel like that? And those are the people you're frustrated with, right?
That's a problem, man, because
what you're calling woke rather than awake, that they see the whole world as doing things to them. And by the way, I could never understand why people wanted lockdowns and wanted masks. But when I started thinking about it that way, I thought, oh, these people are afraid. And because they need the external world to fix their internal world, the external world also has to take care of them. So that's why that's appealing to them.
Give them a sense of validation too. I feel like for
membership.
Me, right, exactly. And for me, I've been fighting since I was 5 years old, and I had to get out of my own hole many, many times. That's just life. For me, my dad taught me how to work as a young kid. I was slapping tar on roofs since I was 12 years old, and learning the value of a dollar. So I've always learned to take responsibility for myself. And being a fighter, you enter the ring alone. You go in with a team, right? You walk through that tunnel, the curtains open up, you walk into the arena, and you get in there with your team, and then they get out. They get out, right? And then you're alone with that guy. It's the loneliest place on earth, and that's why I take full responsibility, and that's why I gravitated to boxing and love boxing so much, is because there's nobody else you can blame. There's nobody you can blame but yourself for your failures, and even the 2 losses that I do have in my career, I completely blame on myself. I tell everyone I had no fear in those fights. Those fights, I had no fear. and it was my fault. I should have had. I thought they were bums. I was like, I'm going to knock these guys out, and I was cocky. And pride comes before the fall. So I always take responsibility for all my actions.
Yeah, humility, gratitude. These are things that seem to be deficient these days. And envy and grievance seems like the order of the hour.
I agree completely. You know, for me, having to rebound and reinvent myself, you know, I even after I got knifed and I went through a lot of drama and emotional. I suffer from massive PTSD still. You know, I went and got a tattoo of the Phoenix on my arm because I planned to make a big comeback in boxing, but little did I know I was going to make a comeback in something completely different, a different arena, a different fighting arena. And it has to do with deep state politics. Go figure, Doc.
Yeah, but isn't it interesting? This is one of the things I like about recovery and mental health treatment generally is if it's done well, you have to be willing to become whoever you're supposed to be, right? You wanted to be the fighter, but however you want to conceive of it, God, the world, your internal world, whatever, however you want to think about it, had something else in mind for you. And here you are.
I think at a higher level, at a spiritual level, I self-sabotaged it. You know, I knew I shouldn't have been drinking. I shouldn't have been doing those things. So that's once again, me taking full responsibility on that. I think if everybody started taking full responsibility of their actions, they would heal that much faster and be able to move on. When you're busy blaming other
agree,
people.
Oh my God, blaming other people. What does that get you? That's never, I mean, you know,
and
that's
those
all
guys
you do
that
have
stabbed me, the guys that stabbed me have still never been caught. And I hold no grudge to them. I'm not angry about it at all. And I really mean that when I say that. I'm healed. I'm okay.
Yeah. I mean, it's a hard thing for people to understand how that works. But it's like, you know, you're being eaten up with anger towards them only eats you up. It doesn't affect them at all.
You know, when I went into the two fights after the incident, I was so mad. And I wanted to just blow up the whole entire world, man. I was just so pissed off. I lost all sense of self. I wasn't training properly. I was just a mess. And I went into those fights as a head case and I lost. I got knocked out, you know, and it happens. And and that's the way it happened. But, my very last fight, obviously I won, you know, I had back surgery immediately after the fight and that took me out. But, you know, it was a valuable lesson for me in my life and my journey because with what I'm doing now, and the pressure and adversity that I had to take in boxing really helped groom me and mold me for what I'm doing now, which is I'm really just trying to wake people up and fight the good fight, man. That's it.
What's coming up on your pod?
Oh, there's tons of stuff. I have you know, as you would call it, conspiracy theories, but I have I mean, I have people that are, in my opinion, behind certain firewalls. I had a lady that was on that's been, you know, MK Ultra her whole life. She's a survivor. There's different things like that on my channel. You got to really, you know, dive deep. I don't want to discuss too much. I want to respect your channel, so I'm not going to discuss too much of it here, but if you really want to dive deep, that's where you go. It's real deep, though. You know, got to have an open mind, but not enough to where your brain falls out.
It's deep enough that that I would get booted off YouTube today between the two of you. If we start going down these paths.
And that's why, and that's how I've stayed on YouTube. I've stayed on YouTube. I use code words. I kind of play charades a little bit. I don't use, because I know the AI is what gets you first, and then a person watches you, and then that's what knocks your channel down.
Yeah, that's exactly right. Caleb, do you have any questions? I'm wondering.
No, I'm building up media and stuff. This is a very interesting story.
You're building up media. Is that what you said?
Yeah, I'm trying to put stuff on screen and get all the social comments. There's a lot of people that love you. They're all in the comments right now, so I'm trying to get as many of them up on screen as I can. They love your stuff.
Got it.
There's a lot of people that love me, and a lot of people that hate me.
When they hate you, what is the issue? What do they take issue with? Just that you're going too far where the brain falls out?
Maybe, yeah. You know, there's that. And then, you know, I've endured it all through my boxing career. You know, it's just part of it. You know, it's just some people like you. Some people don't like you. That's just the way it is. And you just have to get used to, have to get thick skin.
You said one thing that I want to just sort of comment on. You said something about being completely open and honest and then getting on with things, sort of admitting things. But you have to remember that you had an illness, addiction, for which a prominent feature is the inability to see what's happening. That's denial. That's anosognosia. That's what it's part of the condition, right? You're in that. You of course, if you could see it, you could be honest with yourself. But if you literally can't see it, which is what addiction does to you, it's very hard. Very hard. That's why you have to have enough time where you can start to see things clearly. And that's why probably even to this day, you have little insights now and then. You're like, oh shit, I did that. Oh man, right?
Oh, I still can't believe some of the stories my friends tell me. Like I cannot believe it. My sister passed away. My sister died from cirrhosis. So she was a heavy alcoholic. So that was another thing that was weighing heavy on my mind, was that I didn't want my parents to lose their second child. It really hurt our family really bad. And it destroyed it really. And I couldn't be, and I was on my way. I mean, even my dad, he's in his 80s and he was pulling me out of bars. I mean, I was in self-destruction mode all the way. There was no stopping me. In fact, suicide sounded like a good way out, and that's when I say, like, when you hit rock bottom and find out it has a basement, I'm telling you, I was there. It was the 10 years after the incidents and after I lost were the worst years of my life.
Yeah. I hate to see people. Yeah. I hate to see people go into the basement, but some people got to go there. They just have to go there. That's just, you needed to do it and you did it. And I'm glad you're here. Is there, I'm just reading some of the comments about you. Hold on. Yeah, surrender, people. Lakeside Lori is calling it surrender. But Laura, it's a complete surrender, full surrender. It's running up the white flag. And when you're a fighter and that sort of thing, it's you think you're surrendering and you're not. You're still not. So this is a genetic disorder, this kind of addiction, but any kind of addiction, really, when you get right into it. And I'm wondering, so 2 out of 2 kids got it, right? Or were there other kids in the family?
Well, I have 3 sisters. One didn't. And so Patrice, my oldest sister, had it pretty bad. She died at 44. So,
I'm wondering, so it sounds like almost everybody got it, right? And I'm even
not to
wondering
mention
if
my grandmother.
Yeah.
My grandmother
had it.
She committed suicide. My aunt was an alcoholic. My uncle on my mom's side committed suicide.
Okay.
Yeah.
So
David,
when it's everywhere,
family.
But it's all alcoholism when you get right down to it. When it runs everywhere like that, there are certain genetic subsets where it just goes everywhere, and certain North American Indian genetics set that up. So I'm wondering if you have that heritage.
Yes, my dad's side.
Yeah.
Oh
Turkey?
yeah. I mean, I might, if right up the street is a reservation up here in Ruidoso, and I mean, when they get that paycheck, all the Indians are at the bar.
Yeah.
So that's
it's an odd genetics in that it's monstrously powerful, number one, but it gets everybody. Normally it's about 50-50. If you have 4 kids, 2 get it, 2 don't. But certain genetic heritages, it's just everybody gets it. It's just boom. And Cherokee seems to be, in my experience, one of those heritages where if it doesn't manifest, it's usually because someone's got the gene but is so too scared to get near alcohol because they've seen what happened to all their siblings.
I feel like if you say it's a disease and you tell me that, then I won't be able to change it. And if I don't like giving my power away.
I can change disease. Diseases have treatments. These have treatments. Treatment.
Doc, I stopped cold turkey. A lot of people say, why don't you go to AAA? Why didn't you do this? Why didn't you do that? I'm like, just the same way as I entered training camps for fights and I was strong enough to do that mentally, is the same way I stopped this. I don't have any urge to drink again. The only thing I miss is the camaraderie of my friends, the social gatherings, being social. Because, I mean, seriously, think about it. I've lost a lot of friends since I quit drinking, and it's not like you can, as a guy, you don't really call a friend up and say, "Hey, let's go get lunch." They'll say, "No, why don't you just meet me at the bar?" No, everything. Drinking is everything. David, I mean, that's how people do.
I would not criticize or question your recovery in any way whatsoever, but I would say part of what recovery is having those guys over there at the meetings that you go out with afterwards and hang out with, and these kinds of friendships that are around the recovery. And by the way, they're the same guys you drank with. They end up being the same guys. They're just in a different stage of life. so just
I'm open to
FYI.
it. I'm open to it.
Look, you're doing fine. I wouldn't mess with anything. And so I want to bring Melissa in here right now again too. And I want to thank both you guys for being here today. I'll give you both sort of last comments. David, anything you want to say before I wrap this thing up?
No, it's a privilege that you had me on, and my mom's a big fan. I know you didn't want to hear that.
All right, well done. And
I didn't say
Melissa?
grandma, Doc. Don't worry.
I know you spared me that, but you did hear that was a potential answer, a potential concern.
He took my answer. That's what I was gonna say. Oh, well.
All right.
I guess my final thoughts are that I have a lot more evidence. If anybody's interested, reach out. I respond to almost everybody who reaches out to me on my X page. So I'm willing to help.
All right. The X page is, let me get Melissa. It's Melissa McAtee, MCATEE 90. Where is it? 98, 92?
92.
92. And then also the my Clout Hub channel, which is myclout.com/Melissa McAtee. And then David, you can be sure to go watch his YouTube channel, go watch his conversations until your brains fell out, as he says it. And then you've hit critical mass with the experience there. You can go to Nino's NINOS corner.tv and at Nino Boxer on X. Guys, thank you for joining me.
Thank you so much for having us. I appreciate it.
You got it.
Thank you.
And let's throw up again the upcoming guest. We went over it at the beginning of the show today, so I'll just throw them up there again. Tuesday, Wednesday, Thursday of next week. A lot of interesting people. Kyle Kemper is Justin Trudeau's brother. Gabriel Shipton is
Julian Assange.
What's his name? Assange's brother. Thank you. Anyway, we've got a lot of interesting people coming, and do be a part of that. And Salty Cracker, of course, needs no further description. We appreciate you being here, Susan. Anything on your front?
Nope. We have a camera crew in the living
Yeah,
room.
I know. I've got to do something for our TMZ friends. And Caleb, you're all good?
All good. Everything's going great here. Looking forward to a weekend with my babies.
Oh, let's do the Canada and My Pillow thing. Susan, let's remind everybody very quickly that they throw up, if you can, the whatever our My Pillow thing is. Caleb. Yeah, I want to talk about Canada because, Susan and I will be up there at the 3rd annual Reclaiming Canada conference in a couple of weeks. There's mypillow.com/Dr. Drew. It's bringing together leaders from government and digital and platform and all our usual suspects. Steve Kirsch will be there. McCullough will be there. Reish will be there. We'll addressing disinformation, censorship. Goal is to come up with a strategy to address the totalitarian bent and reclaim democracy and freedom, June 21st through 23rd. In Victoria, go to weunify.ca. One word, weunify.ca for information and tickets. And then the mypillow.com/Dr. Drew, is that what it is? We have had such a good time. There it is. What's that? Oh, yeah, I guess they've been kicked off of something, and so we got to support them. They were kicked off of, Caleb, do you know what this story?
I think it's QVC, I believe is what I was told.
QVC.
I think so, yeah.
Yep. And he was welcomed to CNN to the My Pillow headquarters yesterday. This guy is a lot of fun. He's willingness to talk to people, and no matter what the political position is, he'll go in and speak his mind. For odd reasons, again, QVC joined the big box conglomerates in canceling him. He must be too positive. By the way, his team is so positive and so nice. He turned that into some great offers for our audience, among them a free My Pillow 2.0 when you buy one pillow with promo code Dr. Drew. Susan and I love the beach sandals and the towels and the bed toppers. Oh my God, we've been using all their stuff. Go to drdrew.com/mypillow to get deals on your summer merchandise. All right, thank you guys, and we will see you on Tuesday at 3:00 Pacific time. Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.